Hello and welcome back to the next segment of Caretaker's Heart Speaks. I'm April Liverman and I've been a physician assistant for over 20 years. And this month is Breast Cancer Awareness Month. So we're going to be going over some information that I think you need to know going forward. And also I will be doing workshops and Zoom calls and also one-on-one consultations. This is my model, Lily, and I will be using her for self-breast exams to demonstrate what women should be looking for and also what your physician might be looking for when you go in for an exam. So for this segment, we're going to call it Question and Answers presented by Caretaker's Heart Speaks. I'm going to present some commonly asked questions and the answers that I think may be helpful for you. So thank you for joining me. Okay, ladies, we're ready with question number 1. When should I have a mammogram? I often get asked that question, and I wanted to give you some information that you can easily find on the internet. So, the U.S. Preventive Services Task Force said that women should start having screening mammograms at age 50. The American Cancer Society said that women ages 40 to 45 should have a choice in making a decision about having a mammogram, but that women should start at least at age 45. They also recommend that women ages 45 through 55 have a mammogram every year, and after you're over 55 to have it every 2 years. The U.S. Preventive Services Task Force says that after age 74 that you may not need a mammogram. I think that this should be something that you discuss with your primary care doctor to determine what's the best time for you to have a mammogram. In this segment, I wanted to share with you that there may be instances where you may need a mammogram earlier than age 40. And also, there may be other screening methods you can use if you need screening before age 30. Because there are some women that are diagnosed with breast cancer before age 40 or in their early 40s, you may find that a lot of providers are having women have mammograms at age 40, starting at age 40. These are definitely things that I will be discussing in my workshops and Zoom calls with different groups of women, and also one-on-one consultations. Just keep in mind that there are other organizations that recommend that you have mammogram starting at age 40, and also that your primary care doctor or your gynecologist may recommend that you have screening earlier. Question number 2. What type of breast density do I have, and can this be determined by doing a clinical breast exam? Some things have changed in how the radiologist is giving you your report or your findings when you have a mammogram. There may be some descriptive things in the mammogram report that you may not understand. One of the things that's included is the breast density, and that's really important to know because it determines how difficult the mammograms were to read. I often find that members have not even seen a mammogram before. So I'm going to put up a photo of what your mammogram may look like. I'm looking so forward to meeting with some ladies in some groups and going over mammograms and addressing all of the questions that you have. Let's move on to the final question. Question number 3. What is my lifetime risk in comparison to other women if I have a family history of breast cancer? I'm really excited about this question. I will be having sessions where I actually take women and let them calculate their risk based on their family members who've had breast cancer. And then they can look at their lifetime risk, which can determine if you need additional imaging, such as an MRI for screening. Thank you for joining me. I hope you've enjoyed this question and answer short segment. And I hope that you will join me in a workshop, a one-on-one, or a Zoom call so that we can discuss the different questions that you might have. It's been wonderful being able to share this information with you, and I hope it helps someone. So I'd like you to share this video, and maybe you'll help someone to find a breast cancer in an early stage. Thank you.